Good afternoon. My name is Victor Peoples, and I currently serve as the Director of Health and Social Initiatives for Iota Theta Fraternity Incorporated. This evening's Surviving COVID-19 Her Story will take a narrative regarding a young lady's journey and survival during her bout with COVID. The goal of the presenters are members of Iota Theta Fraternity Incorporated who put together this initiative due to the fact that underrepresented minorities often face grim health statistics and disparities. They must cope with obstacles related to education, socioeconomic status, and safety, all of which impact their overall health. Underrepresented minorities are less likely both to get preventive care, and to have access to quality health care when they get sick. This is just one clearly defined factor contributing to the health disparities. The goal of I-PHI, which is Iota Public Health Initiative, is to address health disparities by hosting a series of outreach events that target chronic health conditions specific to underrepresented minorities like diabetes, mental health, obesity, high blood pressure, prostate cancer, nerve loss, and more. Tonight we're doing a program with Good Health Wins, and for over 85 years, the National Council of Negro Women had has been committed to empower, inform, and uplift women and children in communities of color. During the COVID-19 pandemic, they have strengthened their resolve to address the importance of how vaccines save lives. The Good Health Women's Immunization Network, which stands for Good Health Wins, is their commitment and our commitment to build an army of good health champions who understand the importance of immunizations across the lifespan. We would like to educate, advocate, and impact families and communities across the U.S. to both end the pandemic, address health disparities, and shine the light on the importance of good health. Throughout their network of trusted messengers, the grassroots activities, their goal is to, and our goal is to increase vaccination rates, access to health, remove barriers, and access to vaccines and good health. At this time, I would like to introduce to you Dr. Wesley Willis.
Thank you so much, Brother Peoples. Good evening, ladies and gentlemen. Thank you. So yes, COVID-19 has been caused quite a bit of havoc for us for the last couple of years. It really changed the face of both not just physical health, but mental health has brought a lot of disparities and other issues that we've known in healthcare quite to the forefront. Tonight, I am actually very excited to have on to have a conversation with Miss Maribel Blanco. She is a COVID survivor who experienced extreme, significant COVID, and talk about kind of like her lived experience. She is incredibly exciting. She's one of the most caring people that I know. So I really appreciate the love that she's shown by coming on tonight to talk about her experience. Just briefly, kind of like how it felt to kind of like get this diagnosis and what started her journey and kind of like what she's looking forward to. So sit back. I look forward to sharing my experience and also the other brothers' experience. Hi, Maribel. Thank you.
Hi, how are you?
I'm doing wonderful. It's great to see you as always.
Thank you, love. Thank you.
So thank you for sharing with us about your journey with COVID. I remember the conversations that we've had. So it really means a lot to me for you to share this. Okay.
Yes, it
So
was.
like again, like I talked to you earlier, anything that you're willing to share is greatly appreciated. Kind of like what was that like during that time finding out that hey, I have COVID, or what were you in the midst of doing?
It was very sad, very bad. It was came one day from work and until now, I'm not even 100%.
Mhm.
in good health still, but it's been hard as my family, my kids,
Right.
but
Right. So you just kind of like again living your life, and I mean, kind of like what were some of, as you think about it, kind of like some of the stuff going through your mind? I mean, so much stuff was going on TV that we were seeing. A lot of us didn't even know really what we were dealing with, and now you've been told that, hey, I just went to work and now I'm sick.
yes. I thought I was gonna die because in my condition, how I was, how they took me, how they bring me in the hospital, I thought I was not gonna survive. But thanks God, I'm still here
Mhm.
with my kids, my family. But it's very hard, frustrated too.
Mhm.
Yes, I thought I was not gonna survive.
Yeah, I remember the conversation, and we were talking about it because you were at home at the time, and it was like, okay, we got to go to the hospital. How was that? I guess even like when you think about it, hearing even for me, like, okay, the only thing at this point is to go to the hospital. It felt like
Yes.
it was death sentence, or
It was a death sentence. Yes.
hmm,
Thank you. And he said, yes, she has to go to the hospital right away. And I was waiting, scared that I didn't want to go to the hospital because I was
hmm,
very scared. But I know I was dying at the same time too.
hmm,
I
hmm.
feel it, and I know it was in me. Like it was in me.
Right, right. What was it like being in the hospital? Like, because I think we talked a little bit about it, kind of, or at least, me and your family talked about kind of like, hey, they're going to be talking to you, like the idea of being prone and laying on your belly, and, having like this really big, extreme breathing machine breathing for you.
Yes, it was very sad, very bad. I could not even walk. They put me plasma as well. It was very, very sad. And I told them, please don't let me die. I have kids, I got family.
Hmm.
And I couldn't even talk well because I have all these things that I was having, and I had something in my chest, like in my heart area,
Hmm.
that it was having like a machine in that area too.
Right,
Yes. It
right.
was still at this time I cannot even stop thinking.
Hmm.
It's very sad
Right.
for me, my kids, my family. Like, yes.
One of the things about being in the hospital, and hopefully I'll get to talk about this during my presentation, was that it was quite scary too, because it's not like we could have visitors. It was some of the loneliest times in many of our lives. How did you remain hopeful, Mary Bell, you know, through all of that challenge while you were in the hospital kind of alone, and doctors coming in and out, nurses coming in and out, gowning up and gloving up and all of that stuff.
It was sad. I couldn't even talk to my family at all. Just
Mhm,
through a video camera, like from my phone. Oh, the nurse has to. I had to call her to call my family for they could see me and stuff like that.
mhm, mhm. And now you are also experiencing what we've come to find out as like the term long haulers, like, right? Like your health has been affected by, by kind of like COVID. What's been your journey after the hospital, like right now? Anything that you're willing to share?
Well, I've been through a lot of procedures. Um, I'm still dealing with those situations. Like next week, I have another procedure, another surgery too. So it been bad.
Hmm.
It's been back and forth. It's been back and forth. I'm not 100% still in good health. Yes.
Hmm. Hmm. Wow. Well, anything else that you would be willing to share, we would be greatly appreciated, because even though we say we're on the tail end of this, but we still kind of like peaks and valleys, kind of like in this kind of like COVID, monkeypox, all of this stuff. anything that you can share to like people who are watching or about what they should do, what, what can they do for their loved ones in this moment? What do you feel like you need in this moment from your loved ones even?
Share every moment that you have with your family. Like, you know, just any moment is a pleasure. Like, because you know about today, you don't know about what could happen tomorrow.
Right, right. And the thing is, like you said, we're not, well, like it is, truly is, like we're young, old, we don't know, you never know. So people, I think oftentimes when this started was like, oh, I'm young, I'm okay. I may have a little diabetes, or I may have a little high blood pressure. I'll be all right. We thought it was an old people was catching
Mhm.
COVID.
I just recommend everybody to still take care of themselves
Mhm.
and be careful because it's not. It was a no joke at all.
Mhm.
This is very seriously.
Right. Right. Well, I really appreciate you, Mary Bell. You have been such a soldier and a trooper through all of this. I've watched you from the start of this to still being on this journey. And I want you to know that, like, you are always in my prayers.
Thank you so much, love. Thank you, everyone, and have a wonderful night. Thank you again for everything.
Thank you, Mary Bell.
You
So yeah, so thank you again, Mary Bell and her family for sharing this experience. This was a very scary time for me as a provider. I'll be honest. When I first started hearing about COVID, I was like, "Oh, this is going to be the flu. This is going to be nothing." And living in New York City was quite like, "Wow, like this is really serious." And to have people that I know surrounded by me calling me as a healthcare professional saying, "Hey, what's going on? What should I do?" I often felt kind of stumped. Like, what do I tell them to do? Like I'm trying to be, trying to one work in COVID in the hospitals during this very scary time when I'm burying families, grandmothers, daughters, mothers. I have at times buried 4 generations during this time, and it was quite scary. So I appreciate Mary Bell for coming on talking about her experience in this moment. So I'll turn it back over to Brother Peoples because I know that we're going into another part of this segment.
Thank you, Wesley. At this time, we would like to bring on to the screen Dr. Ron Cox Jr.
Thank you very much, Dr. Peoples. I appreciate Maribel for telling us about her story and her journey, and it's a real serious endeavor that a real serious pandemic that we are dealing when it comes to COVID, and especially as it comes to long COVID. So without further ado, I'd like to share some thoughts with everyone with regards to COVID and or long hauler syndrome, as it's known as. All right. So if we can go to slide number 5. And next slide. So for COVID, as we know, this is a worldwide pandemic. It's affected 625 million people worldwide, with 6.5 million deaths. Here in the U.S., we've seen 100 million cases, to 100 million cases, I should say, with a little bit over 1 million deaths. And so it's affected everyone. Everyone has had someone very close to them that has been affected with this pandemic. And I wanted, as we're talking about this long hauler syndrome, or long COVID, as it's known as, I wanted to quick just refresh everyone about the symptoms that are associated with COVID. And I've also listed some percentages just to give you a flavor of how many people within that experience COVID would also experience some of these symptoms. So some of the symptoms associated with include fever, cough, fatigue, anorexia or loss of appetite, shortness of breath, myalgia or muscle pain, insomnia, which is loss of smell, loss of taste, intestinal experiences such as diarrhea, nausea, and I've already hit on anorexia, as well as headaches. Next slide. So as we think about this, the normal progression of COVID lasts up to about 4 weeks. Any symptoms that I've shown or that I've featured on the slide could be an indication of someone presenting with signs of COVID. However, when it seems to be on this 4-week threshold, from 4 to 12 week, we have a condition known as ongoing symptomatic COVID. From 4 to 12 weeks, you continue to experience symptoms, and then continue to experience symptoms after the 12 weeks point. You have what's called post-COVID-19 syndrome, and long COVID, as it's known, is anything that presents with any signs of COVID that present pretty much after 4 weeks, and is really not indicative of any other diseases. So if you have any of the symptoms that I mentioned before, fever, headache, nausea, shortness of breath, that last 4 weeks, then you're in this long hauler syndrome category or long COVID category. Now, 1 in 13 adults, or 7.5% of adults, are going to experience long COVID. To be even more specific, 1 in 5 of folks who are diagnosed or who experience COVID go on to have long COVID symptoms. Next slide. So, as we always talk about, there are factors associated that put you at greater risk of suffering from long COVID. To be fair and to be transparent, scientists really haven't fully identified what are some of the triggers that are, indicative of long COVID, or that, directly link you to long COVID. But there are some things that increase the likelihood for you to get long COVID. We see that within our aging population, folks who have excessive weight or obesity, those who have diobesity, a condition that is basically diabetics that are obese, females to have COVID at a higher rate, also long COVID at a higher rate. Also, those are respiratory issues. As you can imagine, this is a disease, the virus primarily attacks the respiratory system. So if your respiratory system's already compromised, then you're more apt to have longer lingering effects. Multiple symptoms of presentation, which basically, if you have predisposed problems already, heart issues, diabetics, that have cancer, a lot of things. You have to remember that if your body's already weak, then the road to recovery is much longer. And then you have this in category, which is, or as we like to call it, the BIPOC category, Black, Asian, or minority ethnic. And so all of these put you at your risk for experiencing long syndrome or long COVID. Keep in mind that you don't necessarily have to have a positive COVID test to experience long syndrome or long COVID. So the fact that you weren't diagnosed with COVID doesn't mean you didn't have COVID. And if you didn't know that you didn't have COVID, then these could be symptoms that you could be presenting with your knowledge. Next slide. So, as we talked about a little bit before, the symptoms can be multiple and varied, and they can be temporal, and they can fluctuate over time. And, that goes to show that it's a really, really, really complicated issue that these patients deal with. And as you heard from our guest here, that with the amalgamation or the grouping of all of these different factors, make it really, really hard for patients to have a really good quality of life, even after they are released hospital. So what are some of the symptoms, right? Fatigue. There are respiratory symptoms, whether it's persistent shortness of breath, muscle skeleton, which means you can have pain and joint pain and muscle fatigue consistently, headaches, fuzziness or dizziness or memory loss, cardiovascular, heart palpitations or arrhythmias or irregular heartbeats, gastrointestinal, I touched on that before, nausea, bowel changes, indigestion, loss of appetite, persistent fever, rashes, and then also some of the underlying conditions that you already have, like a diabetic, or you're dealing with other conditions, could be worsened by your body already dealing with another infection or disease. One of the things that we really don't touch on as much is the mental impact of this, right? I think Brother Wesley touched on this a lot in terms of the fact that patients also deal with this, and because of the pandemic, they've dealt with this for a large part alone, or with doctors and scientists who are not aware of the treatment that could be ultimately beneficial for them, as we are all just figuring this out. And so one of the things that I want to talk about beyond just lack of sleep and mood changes are also PTSD and post-intensive care syndrome, right? The fact that you were in the intensive care, you didn't know if you were going to make it or not. And that can be something that felt with for a long time. It can be just as dangerous as PTSD. Next slide. So what are the treatments, and how do you deal with this? How can someone get better from and recover from long COVID, right? Breathing exercises, physical therapies, medications, surgeries, and treatments all appear to be helpful depending on the type of symptoms that you're experiencing. There are also some clinical trials that are available for long COVID patients as our medical professionals continue to try to figure out exactly what all goes into this long COVID syndrome. As I said before, the best way to avoid COVID, or as it should be stated and known, the best way to avoid COVID, not to get long COVID, is not to get affected, right? And I think that that is important, that we are vaccinated. That is important that we are up to date on our boosters. That is important that we are still exercising caution when in large crowds with people who you don't know whether or not they're vaccinated. And as a scientist, that's something that I think is highly, highly beneficial as we still figure out what are the triggers molecularly that this disease relies on, and how our body responds to it, especially within the Black community. Most importantly, and it does not go unknown, is that you should consult with your primary care specialist. And I put specialist here because primary care can be primary care physician, your primary care practitioner. You should consult with these folks because of the fact that you need someone who is going to understand your symptoms. You need someone who is going to show empathy to what you're going through, and not try to tell you that, oh, it's the flu, oh, it's this other thing. You also need someone that's willing to sit with you, understand your medical history, and also enable you to get the best treatment that's possible, and the most up-to-date treatment that's possible, that's verified by science and good medical practice. So I just want to say, thank you once again to Mirabelle, our guest speaker, for telling us about our journey. Our millions of folks around the world are dealing with the disease, and that 1 in 5 folks who have COVID are dealing with these long COVID symptoms. And I just wanted to make sure to give you guys some information on what this is and how we can all combat it.
And Dr. Cox, could you please, one thing I did not do is provide your credentials. So would you be able to provide your credentials to the audience, please?
Sure. So I have a PhD in allergy, immunology, and infectious diseases. I work for Regeneron Pharmaceuticals, one of the first companies that was able to develop a drug, RegenCove, treat patients that were experiencing COVID in ICUs all across the country, and actually study the respiratory syndrome in my PhD that caused COVID. That is as a result that results from COVID when I was studying in my PhD. So this hits home from a scientific background and study standpoint. and also from a professional work study standpoint.
Thank you, sir. At this time, we're going to bring Dr. Willis and Hershaw Davis to the screen.
Hello. Thank you, Brother Peoples. So, yes, so Brother Hershaw and I are going to talk about the mental health effects of COVID and long COVID. I feel like when I was asked to do this, I could have talked about it forever. So, my background and specialty is I have a doctorate in psychology. I have also a master's in social work, and I'm also a registered nurse.
My name is Hershaw Davis. I am a clinical nurse faculty at the University of Maryland School of Nursing, and I maintain a practice in the emergency department at Johns Hopkins Hospital. And I've had the ability to see this up close and personal during this pandemic. Dr. Willis.
Great. So we can go to the first slide. All right. So the state of mental health in America has been, even before COVID, mental health was quite stretched. I mean, we had so many individuals who needed mental health, both seeking and not seeking, and very few mental health practitioners. However, again, as you can imagine, COVID has quite strained all of our resources, both from medical practitioners and also mental health practitioners. 1 in 5 individuals, basically. So this came from also from the National Association of Mental Illness, also and CDC, that 1 in 5 individuals have reported that their anxiety and mental health symptoms have deteriorated more so since the beginning of COVID or since the pandemic, and has been affected. So again, 1 in 20 again also have some diagnosed mental health illness, like meaning that they meet the diagnostic criteria of things such as depression and anxiety. On the next slide, we'll talk about how families and children are dealing with this. When you look at in terms of like adolescents, so among the U.S. adolescents 12 to 17, 1 in 6 experienced major depressive episode. 3 million had serious thoughts of suicide. And these numbers, while they were already startling before COVID, even more startling because children were learning from home, children were isolated. So, again, having very limited resources, socialization, which we know is incredibly important in children's growth and development. So they were on Zoom. I mean, we all lived through it to see, again, children having to hide, their lived experience from their classmates and so forth and so on. So all of that that curtain came down, and people were able to see, kind of like the life that kids were living and that youth were living in. And so then going on to the next slide. So like Brother Cox stated, we have over 1 million people that have died in the US from COVID. Again, mothers, fathers, sisters, brothers, children, grandmothers, all, name it all. I mean, over 1 million people. That is a great deal of people. And so, even more so than that, leaving behind families to grieve, which is a big part of what I am seeing as a private practitioner, is dealing with families who are either grieving the loss of a loved one or even grieving, again, like our conversation with Maribel. Her life has changed forever. She has children, she has all of these things. So her life has changed. So grieving the loss of functions, grieving the loss of the ability to go to work, grieving the loss of kind of like, before COVID, we kind of like, you imagine your life saying to yourself, okay, self, I'm going to be 75, I'm going to be 80, I'm going to live a very long life. And then to kind of like take that vision that you had experienced or thought of yourself for the rest of your life now being changed. now creates this sense of like, now I have to go through grief. So the next slide is what we are talking about is grief. So grief and mental health. Grief indicates the experience that one has from the loss that they have. Mourning is the process that you will experience, that people are experiencing. And bereavement is the loss to which the person is trying to adapt and the experience of having lost someone. So these are three, not phases, but three parts of grief, mental health that we're all experiencing in a lot of ways. I, as who was a nurse at the bedside, oftentimes am grieving families that I lost, both personal and that I knew from working at the bedside. So these are very much parts of who you are and who people will be that have lost individuals, both and also their functionality. So when you look at the next slide, there's two different types of grief. There's normal grief, which we all were experiencing beforehand. Like, again, you lose your mother, you lose your grandmother, you lose someone in your family, and you have what we call normal grief, right? You're able to go to the hospital, you're able to be by their side, you're able to, share moments with them. However, abnormal grief is what we experienced during COVID. People afraid for what they were experiencing, people afraid for their parents going into the hospital. Again, as you saw on the television, bodies being in refrigerated trucks, bodies being placed in conference rooms in some nursing homes. It was quite a traumatic experience, and that's what a lot of people are experiencing. It's what we call complicated grief, abnormal grief. It was an abnormal time in our lives, people talking on FaceTime to their mother on the ventilator, not the greatest, not good times. Again, people are experiencing things like moral injury. People are experiencing all different types of ways that they're grieving and going through that are abnormal and that are extended. So, like, again, in the theory of therapy and psychology, normal grief lasts about maybe 6 months, even though nobody can tell you how long you should grieve. Abnormal grief is very complex. Sometimes there's delayed grieving. Sometimes there's this disbelief that it's actually that the person is actually gone. And that's kind of like abnormal grief. Again, I could go on forever because there's even other parts about as we talk about PTSD. Again, from being in the hospital, the trauma, the fear of of dying. What does that feel like to say you may not go home, or that your mom may not go home, or somebody is, so that trauma. Also the fear of going taking it again to your home, to your family, that medical professionals experience is so much, so many layers underneath that the mental health of America has been quite affected by. And I think you go to the next slide. So, getting help is something that's become really, really important. So, they have a new national suicide number. Just like you call 911, you can call 988 and get help to the suicide line. Engaging in self care, seeking out mental health professionals. I'm not going to lie, as a mental health professional, yes, mental health professionals are stretched. However, there's so many places that you can get mental health care and support from, and also talking with a trusted friend. We don't have to go through alone. Hopefully, this sheds light on the experience that all of us went through something. I experienced myself when I got COVID as a nurse about COVID shaming. I felt ashamed to tell someone that I had COVID. Even from other health professionals was like, you got COVID? Like, how could you allow this to happen to yourself? Where I was like, oh, geez, like this is, like I was ashamed to have caught COVID, So there's so many layers around the psychology and mental health of, COVID and the like that we should never be feeling like we're alone. A lot of us were in this and we're all in this together if we're going to get through it. And that's it.
Okay. I'd like to add something in when Dr. Wells, you were talking about, the the psychological and mental health effects of COVID. And like you, I was at the bedside. I actually lost my mother during COVID. And so having to deal with a delayed funeral, the lack of communal grieving that we as a culture are used to doing. We delayed my mother's funeral for a year because of what was going on. And so when we think about mental health and we think about COVID, one of the things I think about is resiliency. How do we bounce back? Because there's been a lot of conversation about post COVID, but that's a bit of cognitive dissonance because COVID is still here.
Mm-hmm.
So, how do we move on for something that's here when we never really healed from the trauma that you were just talking about? And
Mm-hmm.
then you look at, to be honest, everybody, when the world opened back up, we could go back outside. Everybody was expecting to be back to 2019 and not really saying out loud what was will never be. So how do we deal in this new normal and have that conversation? And resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or other significant sources of stress. It's basically the ability to bounce back. So one of the things when I talk with people, patients, friends, is talk about how do you be resilient. And I think the greatest thing to do, or the first place to start, is just acknowledging, what are you grieving? How are you grieving? For whom are you grieving? And how have you coped with grief and loss during this period? And then, like you talked about, incorporating those self-care activities. Because as healthcare providers, we take care of everybody else. But how much time do we spend taking care of us? And that could be if you're a person who's taking care of your family, loved ones, community. How do you put self-care as a part of your resiliency strategy as we're still dealing with the effects of COVID? Whether it be, like you said, talking to friends, going out to the movies, trying to put some sense of normalcy back into your life. And often at the university, when I talk to my students and they're being stressed about exams and things like that, and I often tell them, take one night a week, no phone, no nothing, just do something for you to push that internal reset and be able to recharge to deal with whatever external forces that you're dealing with in your life. And so I just wanted to say that piece is that, we have to really talk about resiliency in this because I think it's key for individuals to get on the other side of COVID and what I see in my practice at the bedside in the emergency department.
Mm-hmm. Mm-hmm. Thank you, Brother Hershaw. I agree. And one of the things that I love that conversation about resiliency is because the other part of this is like we don't want people to think that just because I'm not resilient that I'm weak.
Yes.
Exactly. We all deal with and process things together. Self-care is one of those great things that we talk about, but self-care has to be deliberate. So when Brother Hershaw, instructs you, hey, go to the movies, bring some normally, make it deliberate. Recognize, say, hey, this is my time for me. This is my time to take care of myself. Even if that taking care of yourself is watching Netflix, protect your Netflix night. Protect that Netflix with your mind, for your mind, not just kind of like, oh, I go watch Netflix to veg out, but I watch Netflix to take care of me and to just spend some time like in that way. So thank you, Brother Hershaw. I really appreciate that. I think we're good. Do you want us to answer the questions? I don't know, brother.
No,
People.
we're going to answer the questions in a few, but
Okay.
I appreciate you, Dr. Wilson, Hershaw, Brother Davis. Appreciate you guys. If you could just hold on for a few, we'll bring everybody back on in a few. At this point, as we talk about the COVID, monkeypox, the flu, it's always something about the vaccine. And in the African American community, there was so much about vaccine hesitancy. So today we're going to answer some of those questions and provide information regarding the vaccines. So at this time, I would like to bring on John Dorr and Corey Holland, or doctors, I'm sorry.
Hey, thank you. Our people appreciate it. So my name is Jonathan Dorff. I'm a pharmacist by trade. I actually operate multiple pharmacies now. And I'm here today with Corey Holland. I'll let him introduce himself. We're going to talk about vaccines and vaccine hesitancy, more importantly, something that the minority community really has kind of come in contact with a little bit more frequently than we want to see. So we're here to hopefully help dispel some myths and help the community.
And my name is Corey Holland. By trade, also, I'm a pharmacist. I'm a director of pharmacy at a long-term acute care hospital, which is really a smaller kind of hospital here in Indianapolis, Indiana. During the COVID pandemic, especially early on, our primary focus was really to kind of help the bigger hospitals with their resources. And so we heard a lot about ventilator shortage and things like that, bed shortages in the ICUs and things like that. Our facility, we didn't take a lot of COVID patients in the beginning. And so what we did was we took the patients that didn't have COVID, which then freed up those beds and those ventilators for the bigger hospitals, for them to be able to take care of more patients. And so I kind of navigate that space and kind of transitioned. And now we want to bring more awareness, like Brother Jonathan said, to vaccines, because there's been a lot of controversy, a lot of talk, a lot of issues that have, and misinformation that's gone out. And so we just want to educate and talk about those things. So if we want to bring the slides up. So the first thing we want to talk about is what do vaccines do? And in order to do that, we kind of want to back up a little bit and talk about our own bodies and how our bodies kind of help in its own natural defenses. And so if you think about it, your body actually does have some really good defense built in already. We all heard in health class about our white blood cells and how they help us fight off invading germs and bacteria and things like that. And so we have what's called our white blood cells that have these cells called macrophages. Okay, and what these do is they'll lock onto an invading germ and they'll follow it around, and they follow it around really well, and they keep following it until they actually catch it, and then they swallow and digest it. Once they do that, they leave behind what's called antigens, which are little pieces of the bacteria or the germ or the virus. They leave that behind so that other cells can kind of come up and recognize it. And so the second type of cell we want to talk about are these B cells. And what these B cells do is when that germ or that bacteria invades again, it recognizes it, and it creates what's called antibodies. And so we've heard of things like antibiotics or medicines and things like that we use to take care of our sicknesses. It's kind of your body's built-in antibiotics. Okay, and so the B cells produce that. And then the third type of white blood cell is called your T helper cells or your T cells. And what these do is they memorize what's already invaded your body. And so how this all works and plays together is the macrophages ingest the invading bacteria. Then the T cells kind of piece together what that was. And when it comes back again, they help the B cells create the antibodies. And so then you respond a lot quicker to an infection or to an invading germ or species, a lot quicker the second, third, fourth go around. Okay. And so that's just kind of the body's built-in defense mechanism. So where vaccines fit in all of this is they basically imitate, go back. Where they fit in this is they imitate the infection. Okay, so this allows the body to basically feel like it's been invaded by something, And so we'll put a weakened or killed germ inside and allow your body to basically react to it as if it were getting an infection without having to have the risk of really getting that severe those severe reactions. So kind of like with COVID, where we have complications risk, we have long hauler syndromes and things like that. You don't have as big of a risk as you would if you get the vaccine than getting it naturally. You get a natural infection. Now we can go to the next slide. So what types of vaccines are there? All right, and so there's a lot of vaccines that been out over the years that we've used and things like that. So it's a really long, exhausting list, and so we won't go through all of them. I kind of just want to highlight a few. And so the first one is called a live attenuated. All right, and that basically means a live virus that's been weakened so much that it won't cause a severe infection. Okay, now why would we do something like that? Well, the reason is because it's the closest thing we can come to an actual infection. All right, so the virus has been weakened so much that it won't cause any kind of severe reaction. It won't cause any kind of severe sicknesses and things like that. And so we've used these a lot. And so if you think about vaccines that you may have had, measles, mumps, rubella, your school time vaccines, your chickenpox vaccine, those are all live attenuated or live viruses that have been weakened to the point that they can't cause an infection in normal with folks with people with normal healthy immune systems. Now, not every immune system can handle this, so sometimes we'll have to do a dead virus, all right, or inactivated virus. So you might have heard of something called inactivated. That would be something like polio or hepatitis A. And basically, these kinds of vaccines, they don't have a stronger response. They don't cause as stronger responses as the live viruses. And so generally those require multiple doses. All right, so you hear about your hepatitis series, things like that. So those would be your inactivated viruses. And then a third kind that we want to talk about is this. It's new to us, really, the mRNA virus. And it's actually been around for well over 15, 20 years. So it's not exactly new technology. But what this does is it teaches our cells how to make the antigens that we talked about that trigger the immune response. All right. And so the COVID vaccine takes advantage of this technology. And so the good thing about it, the great thing about it actually, is it allows your body to develop this immunity, develop this response without actually having to introduce the virus into the body. And so what happens is the sequence is created. We put it in the vaccine. We administer it to someone. It teaches the cells how to make those triggers, those markers, and then it actually degrades itself. All right, and so it's not left in the body. Once it's used, it's gone. Next slide, please. And so finally, we want to talk about some of the myths and things that we've heard. We've all heard some information about vaccines, some good, some bad. Not all of them are true. And so there's a lot of things that's gone out over the past several years about vaccines, about the COVID vaccine, things like that. You guys might have heard a whole host of things. And so I just want to deal with a few of them. And so the first one is that vaccines cause the disease that they're trying to prevent. All right. And so this kind of comes from a lot of times where someone will get a vaccination and then they feel sick afterwards. All right. So some common side effects, as with everything, every medication that we kind of use has a risk of some side effects. So common side effects that are associated with vaccinations are soreness, nausea, fever. All right. That kind of sounds like, well, I'm getting sick, but it's your body actually building up that response and responding to the vaccine. It's not you actually being sick, so you're not infected with that virus or that germ. Now, with everything, there are some major side effects that can happen. All right, that's just the nature of medications and us treating ourselves with things. And so, you've heard about the blood clots, you've heard about, severe rashes and things like that. Those do happen to a small number of people. And so you never say that any vaccine or medication is 100% safe and 100%, it absolutely won't cause anything major. In a few people, it will. But for the majority of folks out there, and for the majority of the patient population that take these vaccines, they're only going to experience those common minor side effects. Another common myth that you've heard is that they contain harmful chemicals. All right. Now, there's a couple of ingredients in vaccines that kind of are targeted when we talk about toxic chemicals. One thing to remember: even water is toxic if you drink enough. But aluminum is a commonly used what's called an adjuvant. All right, it's used to kind of help the body respond stronger to the vaccine. It's used in a lot of medications like antacids, aspirins, and cosmetics that we use every day. The other chemical that generally is pointed out when we discuss these things is the formaldehyde. And a lot of people don't know that the body actually produces more formaldehyde naturally than you would ever get in a single dose of a vaccine. So these are some of the things where people would kind of say, well, I wouldn't get the vaccine because of this. Well, these things don't make the vaccine toxic. They don't make them harmful. They're not put in there to hurt us. They're actually some of their help. They actually help the response that we have to the vaccine. And the third one that I commonly hear in my practice from my patients and also when talking to people in the community is that natural immunity is actually healthier and safer than vaccine-induced immunity. And so when we talk about natural immunity, that you get the actual infection, and then your body builds up the immunity to the infection, and so it comes back healthier, stronger, and all of that. And yes, while that's true, a lot of times natural immunity is stronger than vaccine-induced immunity. It's a big risk that you're taking. So if I risk getting COVID, and I want to risk that over getting a vaccine, there's a very good chance I may not make it out alive to have that immunity. And so the risk just does not outweigh the benefit when it comes to natural immunity versus vaccine induced. And so those are some of the things that we kind of hear in the community when we're in our pharmacies. And so we just want to educate so that people can keep themselves safe. Jonathan, if you have anything to add on that.
No, absolutely. And we'll be happy to answer any questions, dispel any myths that Joe may have heard. It's really important that when you're there in the community, if you have any knowledge about healthcare, about vaccines, that you dispel those myths of your friends and family. You make sure they understand the truth, because at the end of the day, it's really critical in protecting our communities. If we didn't come up with these vaccines, we would have a lot more illness, a lot more death than what we encounter now. So it's really important for everybody to take an active role and getting protected and making sure to educate their family and friends too.
So thank you, Jonathan and Corey. Definitely appreciate your insight and expertise. At this time, I'm going to bring all the professionals onto the screen right now. And with this, and right now, we would like to give those that are participating an opportunity to ask any questions that you may want to ask to the experts. So we'll call this portion "Ask the Experts." I know we had a one question in the chat that was directed toward Dr. Wesley. There it is. How do you avoid the negative stigma of mental health in Black and Brown communities?
I think, I mean, that's a very interesting question. I feel like we've often been carrying this cross and message for quite some time about kind of like, how do we address this issue? I think that one of the bigger things is normalizing, that it's okay to seek help and that isn't a sign of weakness. Because I think that we have put on this idea about that we all have to be strong and that we all have to be, not appear, that it means that we're obviously weak. So I think that that's one thing. Somebody asked about COVID shaming. Why aren't we past COVID shaming? I think that one of the bigger things is the messages that we put out. Again, the idea that healthcare professionals, that nurses, doctors, that we are somehow superheroes. I'm a regular person. I get COVID, and we do it to ourselves, as healthcare professionals. Like, if a nurse tells another nurse, "Oh, I'm going to see a therapist," it's like, "What's wrong with you?" Versus like, "Wow, that's really good that you're going to get some support in a time where we're dealing with some really, really hard things." So I think if we start normalizing that it's okay to not be okay, then we'll get there eventually. But I think just like in any race or whatever, we're going to struggle quite often sometimes with people who just don't want to get on board and they're going to feel what and going to say what they feel or not want to go along with it. So that's what I think. I think as we see more, unfortunately, older people who are unwilling to be different and change their way, kind of like the younger sometimes have to lead the older people to kind of like say, "Hey, this is a new day and it's not okay to suffer in silence, to experience all of the things that you have experienced and we're experiencing and not talk about it."
Thank you. Our next question comes from Ms. Kathy Morris. She states that, "I know that having diabetes complicates the recovery process, but can you explain why?" Who would like to tackle this?
I'll grab this one. I'm Ms. Kathy. Appreciate the question. So with diabetes, one of the biggest things that comes with the disease is kind of a decrease in circulation. That decrease reduces your blood flow. And that's why you hear about things in diabetes with complications in eye care and foot care. Because of that decrease in blood flow, it takes our body a little bit longer to get those white blood cells to the area to heal like we really want it to. And so with well-managed diabetes, it can really help you to reduce that time that you would be infected or that you would be sick. And it can really help you to heal a little bit quicker. It's also really important, in addition to taking your medications properly, is to get vaccinated. A person with diabetes is 3 times more likely to end up in the hospital with severe complications for pneumonia and 10 times more likely to end up in the hospital with the flu. So it's really important to get those vaccines because that's going to really help prevent that length of time that it takes you to heal, as well as hopefully prevent that illness.
Yeah, and I can add on to that in the sense that keep in mind that folks with diabetes, they struggle with, providing the fuel necessary for us, in terms of glucose and things like that. And so when you have that kind of insulin deprivation, your body turns to kind of a form to kind of produce its fuel. And so this fuel is kind of called your ketones. And so when you have too much of these ketones that are circulating everywhere, you could your system becomes quite acidic, and you're at risk for a condition known as sepsis or septic shock. You already have an active infection. And so what sepsis is kind of an uncontrolled response to an infection by your body. And so you have mass inflammatory triggers that are going on in your bloodstream that are uncontrolled. And so diabetics, as Dr. Dorff mentioned, are more inclined to face this septic shock because they're already at a disadvantage with improper fuel, having to rely sometimes on alternative fuel sources.
Yeah, next question we have from, and please forgive me, I think this is DC, is it Leta or DCLETA? So I'm hoping that I pronounced it right, but this is for Corey Holland. Dr. Holland, this is regarding the shingles. Can you read that on the screen? So it says shingles comes from varicella. Chickenpox is a shingles also considered is it also considered an attenuator? I don't know how to pronounce that. My apologies. I butchered it.
So the shingles vaccine is I believe is one of the attenuated. So remember, when we say attenuated, it just means weakened. And so it's not the vaccine itself doesn't do anything except cause a response. And so it's basically, are we giving you a live vaccine that's killed? I mean, that's weakened, or are we giving you a dead basically vaccine? And so the shingles I believe would fall into that live attenuated category.
Yeah, and I think it's important to note there are two shingles vaccines, Zostavax and Shingrix. Zostavax was your live attenuated, where Shingrix is a recombinant. It's a dead vaccine, and has shown a lot more efficacy than the live attenuated. So the newest one, the Shingrix, is definitely the more recommended. It is still a 2-dose series, just like Zostavax was.
Thank you. This question comes from a Facebook user. It says, what would be your suggestion of best practices to a municipal elected official of a city with a population of 400,000?
Can try to help answer that one. So one of the biggest things, if you are an elected official, if you're somebody in an area of power over kind of a community, I think the biggest thing for you is really to bring about change in your area or your community. So making sure that people are educated around those illnesses and health disparities that the community has, and try to kind of shorten that gap. Additionally, partnering with local health officials, partnering with local healthcare businesses, pharmacies, local hospitals, and doctors' offices to try to start a program or help to build a program in your community that can educate folks. Good Health Wins is a really great opportunity for that partnership. I recommend you look into it. I think we'll have a QR code at the end. But that can really help you in your community to really drive the meaning of healthcare and really kind of bring about change in your community. That's really the best thing I can tell you to do.
Thank you, John. Our next question comes from, is it DeCoven Cloud? DeCoven. It says, if you get COVID and have natural immunity as a result, how long should you wait to get the vaccine or booster? Cherry?
I can talk about this a little bit. So the CDC recommends that, about 2 months. And the reason being is that according to studies that's been done, that the increased time between your infection and the vaccination can improve your immune response to that vaccine. And so you don't want to get it, right after you've gotten that infection. You're still responding to that natural infection that you're getting. So you want to wait a couple months, 2 or 3 months after that infection, to then get the booster, to then kind of reboost that immune response to it.
Thank you. Next question comes from Ms. Crystal M. Wells. It says, all of you have seen and supported many of these diseases and others. Where do you, the professionals, go to digress for your own therapy? So that's for all of you guys on the panel.
I can speak for myself. One of the things in being a therapist is being engaged in your own therapy. So I have been engaged in my own therapy for several years, even during the pandemic, working at the bedside as a nurse. Oftentimes had the opportunity in therapy to talk about kind of what that was like being in an ICU, sometimes getting 4 or 5 patients who were, I remember actually having to process with my own therapist. I will never forget my first night on the COVID unit, putting 4 bodies in a body bag. And it wasn't even 12 o'clock within 4 hours of my shift. And that was my first night on the COVID unit and what that felt like. So I think that, individuals who have worked through this have to get in some ways some type of therapy conversation to process this and try to make sense of it all, because a lot of times it won't make sense. I think one of the good things was the American Nurses Association had partnered and was encouraging nurses to get mental health. Also, another great thing during that time, many states and many health insurance plans waived the co-insurance deductible and co-pays for individuals who worked on the front lines for mental health care. There were several organizations, unfortunately, money's whatever, it's the politics, whatever, but were around providing free telehealth for first line healthcare, first line workers. So I mean, we had it there, but I mean, that's just how, how I've dealt with it and how I still continue when those feelings come up. And, I'm watching the show, like P-Valley that several episodes ago, watching the beginning of the episode where the wife was a doctor and what that was like. It triggered me, and I talked about it, not just to my therapist, but I talked about it aloud, what that was like to kind of like see that like in face to face, being afraid to bring that home. So, I mean, talking about it is very important.
Does anyone else want to tackle that one, or should I go on to the next question?
Yes, I too, like
All right,
Dr. Willis, worked on the COVID. Can you hear me? Yes, I too, like Dr. Willis, worked on the COVID units. I worked many of 72-hour weeks, 80-hour weeks, and for myself, I definitely designate mental health days, or what we now call like self-care days, which usually for me, I usually incorporate exercise, I incorporate a massage, reading, traveling. Those are a lot of like therapeutic things for me. I too also have a therapist that helps me get through some of the hard conversations of just like working, because many times a lot of my cohorts have, start developing bad practices like avoidant and stuff. And so I've definitely been with my therapist as well.
Thank you. We have another question from a Miss Kimberly Page Taylor, and she indicates that her therapist recently passed away, and she would like to know how to move forward in finding another trusted therapist.
Well, I think what are some of the good things that are out there is we've seen like this almost explosion. One, when you build a rapport and a relationship with a therapist or anybody, that one, it's not going to be the same. Just so, not expecting the same from that next person or that next therapist that comes into your life is just the reality of it all. However, I think the other great part of it, though, we've seen like this really really big promotion of things. Like there's therapy for Black kids, there's therapy for Black girls, there's therapy for girls, there's therapy for Black kings. And so, we have seen a springing up of resources that provide places where people can go, people like us, Black and brown folk, who can go and say, hey, that therapist looks like me, that psychologist looks like me, that psychiatrist looks like me. They talk the same way that I do. They understand a little bit of the lived experience that I have, even though, nobody can know your lived experience but you. So Kimberly, I think that like I said, not expecting that same therapist to come in and be a new therapist to be that same therapist, but also, like I tell all my patients, you have to say, hey doc, I don't like when you talk before I talk, or I don't like or I don't like to sit through the whole entire session and I be the only one talking. You have to train me so that I know how to show up, and you have to do it for people who care about you, to teach them how to show up for you and to support you and be a container for your emotions.
Sean, did you want to piggyback on that? Okay. Not. I'll go to the next question. There was another question from Miss, where'd my question go? Kathy Morris. And she asks, are there any legislative actions coming up that we should be aware of?
I mean, none that I know of. I think that the problem has been is that we're all seeking to try to normalize it, and a lot of people aren't talking about it anymore, which is incredibly startling and scary. The way that we avoid this conversation like the plague, like we want to forget about it, like we want to move past it, and we don't want to, without kind of like, again, we're coming into November, and we're coming into elections and stuff like that. People need to be held accountable. So unfortunately, not enough legislative actions are happening with our assemblymen, with our councilwomen, and all of those things, from my personal knowledge and my experience.
I will say from a pharmacy standpoint, and as a pharmacist, I'm an advocate for the profession as well. So, but we've seen a lot of legislative action kind of rev up in the pharmacy spectrum. You had the pharmacist's ability to prescribe the Paxlovid for treatment of patients with COVID. The pharmacist being able to provide a lot of the vaccines for patients. And so the pharmacy and the pharmacist is a really accessible discipline or professional that you have in your communities. We're in your neighborhoods, things like that. So for us to be able to provide services to a patient that has COVID, that's had COVID, and is dealing with symptoms and things like that, to be able to vaccinate the community, to be able to treat patients in the community that have COVID. Those kinds of things are kind of revving up in the halls of the legislatures, both at the state and federal level. And so we are seeing some legislative action on the COVID front that are allowing some of the professionals, because not everyone can get into to see the physician. You go and you try to set up an appointment. The next available appointment's probably about 2-3 months down the line, but you need help today. And so, what pharmacists are saying is we're accessible, we're here, we're available. Let us kind of expand our discipline, our authorities, our reach, and to be able to provide for these patients. And so those are some of the things that are kind of happening on the legislative front.
Yeah, and I'll piggyback
I'd
off
like
what
to,
Corey
yeah.
is adding here. The Inflation Reduction Act actually adds some ability for especially our Medicare patients, Medicare Part D patients, to get vaccines such as shingles at no cost. It also is going to help with insulin over the next 2 years. So there's a lot of things coming to help try to save folks money when it comes to their healthcare. So some really awesome things coming. Wish they were here already, but over the next 2 years, there's a lot as part of that act that will help reduce some of those healthcare costs.
And
So the
similarly in
next question
nursing,
will be,
can I
sorry,
speak a little bit on
go ahead,
this
I'm
as
sorry.
well? Yeah, similarly, there's similar things going on in nursing. One of the biggest problems we have in the healthcare system is the shortage at the bedside. And so there's been a push to create more funding to expand the pipeline of nurses to the bedside because, quite frankly, we're the backbone of the healthcare system. And then, two, when you talk about the expansion of providers, there's a movement to create or decrease barriers for nurse practitioners to prescribe across the country, which is called the Nurse Compact Act. So there's a movement not only for the registered nurse, but also for the nurse practitioners as well to help be able to treat more of the country. And I was there legislating in Capitol Hill when we did the mental health funding a couple years ago. And so I know that helped to break down a lot of barriers to expand mental healthcare access. So um, personally, as we head into the winter months, I know in the Southern Hemisphere, this is one of the worst flu seasons they've seen. And so similarly, you're starting to hear conversations in healthcare revving up to get prepared for the winter months because it may be a brutal winter with both flu and COVID. So they're looking at that, and I'm sure funding will follow post-election.
Thank you. So these next two questions, guys, are going to be our last two questions. And following these questions, we would just like to give your final words. So the next one comes from Ms. Kenya Williams, and she asks, what would you share with seasoned members of our community to help with COVID-19 vaccination hesitancy?
Um, From my perspective, we went out in the community. I'm a part of a coalition in Baltimore of HIV providers, and we do education for not only HIV, but also separate, not separate, but different healthcare disparities within um, around the Baltimore area. And so one of the biggest things that I've learned is to listen. Sometimes as healthcare providers, we get sometimes tunnel vision because we have different things we have to accomplish. But when you talk about vaccine hesitancy, you listen very respectfully, you educate, and let the patient make the decision. I know for myself, I was one of the first people to get the COVID vaccine because of where I practice in the ER. And I admit I was nervous. And you got that sheet of paper that said it wasn't, authorized by the FDA, emergency use. And I remember reading the sheet, not knowing the consequences. So I've been able to go out in the community to convince friends, family members. And what I teach the nursing students is to step back and listen. Listen to the concerns, listen to people's feelings, and create a space where people feel heard. I really feel that patients feeling is sometimes the biggest battle in vaccine hesitancy because people don't feel like they're being heard in their own healthcare decisions. So that's just my personal experience. Brothers, I don't know if
Before
you've
you,
had different
Yeah,
experiences.
I would
Yes.
definitely
Ooh.
add on to that and say that we working at a pharmaceutical company, we're very cognizant of, especially in some of our more diverse efforts, very cognizant of how this gets translated within the Black community. You're being a part of a community that has been, the most taken advantage of when it comes to medical atrocities and things of that nature. And so, I think important thing for some of our seasoned um, members of our community who are a bit close to the timestamp of when some of those things occurred, or some of those stories were passed down, or that have this lack of trust with science, healthcare, is to find a provider that identifies, or a person that is well educated within the medical field that identifies and looks like you, so that can be a trusting environment, right? That can be an environment where you can someone can listen, someone can identify, someone can empathize with your concerns, but also it's representative and they like you, so that when you're hearing these things, you're more comfortable. So I think representation matters in that area, for us to be able to have outcomes as well.
So before, if Hershaw, if you don't mind, I actually butchered Miss Williams' question. It was a two-part. It says, Brother Hershaw, you mentioned being a clinical faculty at University of Maryland. What teaching methods are you using with our next generation of healthcare leaders that we can share with seasoned members of our community to help with COVID-19 vaccination hesitancy?
Similar to what I just described, we actually had a grant through Baltimore City where we went out and educated health providers, both nursing students and also seasoned providers. And one of the biggest things is what I talked about was creating a listening space, making sure the patient is heard and acknowledged, and then teaching about resiliency for the healthcare providers so they can put it into practice, but also teach their patients. But I think when you talk about vaccine hesitancy, I really feel making the patient feel heard and acknowledged is some of the biggest battles in vaccine hesitancy. That may not be everybody's experience, but that's just some of the things I've seen in our communities, particularly in Baltimore.
Thank you. And I'm sorry about that, Ms. Williams. Does anyone else have a comment on that piece as far as the hesitancy piece?
I will throw in one final comment whenever we bring up this topic, I always send out a challenge to my colleagues in health professions, as particularly us as Black healthcare professionals and those of us that advocate. We have a responsibility, not just an opportunity, but I believe we have a responsibility to kind of to combat vaccine hesitancy in our community head on by first recognizing that we are a part of the community that's been hurt, that's been harmed by the systemic practices that have happened. We have a responsibility to recognize that and to kind of be the face of change, to say, I am a healthcare professional. I'm a minority, or I'm a Black healthcare professional, and I understand where you're coming from. And because I understand where you're coming from, I want to let you know that this is what I'm doing and this is what we're doing to kind of help keep those things from happening again. And so that's my challenge and my charge to those of us in healthcare to face this challenge head on and to help our patients get to a place where they do have more faith in healthcare.
So thank you, Corey. So last question, for real. It says, and this is again from Ms. Williams, and this is to the general panel. It says, what recommendations do you all have? She said all. Do you all have to help parents understand the importance of vaccination for the pediatrics population? Her concern to lower the number of vaccinated pediatric patients. The lower number of vaccinated pediatric patients.
Yeah, Ms. Williams, you bring up a great point. We have had a drastic decrease in our pediatric populations getting vaccinated. I think I saw a recent study. I mean, we're talking 20, 30, even 40% in some areas in the pediatric population. And that's when you get the most vaccines that protect you. It's your childhood series ends up being hepatitis B now, hepatitis A. Those of us born in early 90s and 80s and 70s, those weren't part of our childhood vaccine series. And there's a very small population of adults that have those. The most important thing that I can stress when it comes to getting our pediatric population vaccinated is our adults have to be our role models. We have to make sure that they are taking the time to learn themselves and educate our children, that they're being the face of that they are going and getting vaccinated themselves, and getting protected. It protects your family when you do, and that you're making that impact if you're a healthcare provider, by having that conversation with the parent and the kid and making it a safe place for the child. Our pharmacies, our local retail pharmacies, are some of the greatest avenues for that. Stickers, popsicles, talking about your favorite TV show, your favorite school class, to get your mind off of that shot. I was somebody that could not stand shots as a child whatsoever. It took 10 people to hold me down. But at the end of the day, getting those vaccines is really what's going to protect our childhood population and hopefully prevent that next pandemic. And that's really the whole goal of that. So making sure that they can do everything in your power as an adult to get your children, your family's children vaccinated is really critical.
And yes, Dr. Williams, thank you so much. I know Dr. Williams, by the way. I think, I mean, what I'm seeing actually is very startling because pediatric ICU admissions are going up. They're actually going through the roof in a lot of parts of the country. So this vaccination is very important. So again, talking to our sisters, talking to our brothers and family who have children and saying, you know what, as an aunt, as an uncle, I don't want to, see little Johnny or whatever in an ICU or a pediatric ICU. So, compelling our family, talking to one another is I think one of the best ways of kind of like trying to kind of combat this lower number of unvaccinated pediatric patients that we're seeing. I think another part is, actually showing on TV and actually, kind of like letting people know, I think this idea of if we don't talk about it, it doesn't exist, is really a problem. I think one of the bigger things about COVID was the fact that we were showing people in the hospital that people are getting sick, that this is something serious. So if you show parents and let parents know, like, hey, no, this is not a myth. This is not some political game. Then they'll say, okay, you know what? I lived in this kind of idea that, that they'll be okay just because they're young, and that's not the reality.
Anyone else? All right, so at this time, definitely on behalf of our 23rd International Grand Polaris, Sean D. Housen, senior in the administration, our current 23rd administration, we'd like to thank all the panelists and everyone that was in attendance this evening. At this time, I would like to, however, for the panelists to provide any closing words, especially as it relates to getting this message out to our neighborhoods, our communities, the places where we live, work. But more importantly, what is the importance of getting vaccinated? So I will start in my top left-hand corner, and that comes to Wesley.
Like I said, the most important thing for me as a not just a mental health practitioner, but also a physical health practitioner is the reality of, it's okay to not be okay and say, hey, you know what? We got to talk about it openly, talk about it in our churches, talk about it and at the barbershop, talk about it wherever we could go and just normalize this as a part of what we're experiencing as opposed to trying to stomp down all of these emotions and move on. This idea of business as usual is out the door. It's no longer business as usual. It's a new day. We're dealing with so many different things, not just from just from a medical perspective, from a financial perspective. So I think if we really, 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 really kind of like band together all as a community, then we'll get through it.
Thank you. Next on my screen is Dr. Cox, please.
Yes. So first off, I just want to say thank you to all my brothers and colleagues for the amazing information that's shared. And for anybody else, I guess my word would be, you don't have to. We live in a day and age where so much information is around us, right? And with that is good information that is information that's passed on that's just not quite right. And we suffer from what I call kind of you have a epidemic, a pandemic, and when we have an infodemic, and to make sure that the information that we're passing along is appropriate, is coming from credible sources. As a scientist, I can say that my first inclination is always to go to credible sources and figure out what is the newest and latest updates you can see and the trends that we can see in this pandemic to be able to make decisions, not only for yourself, those around you, those loved ones around you. It's not, as was said before, this is something that is the new frontier for us. It's going to be something that we live with for the foreseeable future. And so what are we doing to make sure to make it easier on the next person? And we pass down information to make our journey a lot easier. And people really have to consider that and think about that. And knowing the challenge that was issued to providers, to representatives, to be there and to understand and to be empathetic and deliver news and messages with kindness and to make sure that if you can reach at least one person, change one person's mind, that that's a sincere win. Though it starts with you, whether you have a medical degree, a PhD, a PharmD, a nursing degree, or just you yourself, a degree in you yourself. Knowing yourself, being honest with yourself, being able to be vulnerable with your provider, whether that's a mental health provider or a medical, a physical medical provider or what have you, and getting the best care that you can for you and your family.
Thank you. Next is Rakim Cherry.
I would like to reiterate, you are your best advocate. I always tell my patients, you are your best advocate. Be sure to, like everyone else has said, educate yourself. You have to be able to make the best informed decision for yourself. And if you're a parent or a caretaker of another loved one, many times you're stuck with making very important decisions. So get all the research. And as the previous doctor said, reach out to a resource in your community, be a pharmacist, be a nurse, be a doctor. Be patient with your providers also. Like I said, the research is new and ongoing, so it's forever changing.
Thank you. Next is Brother Corey, Dr. Holland.
Yes, and so first of all, I want to say thank you everyone that came out. Thanks for a great conversation, great questions. And so one thing I want to leave with is that kind of like Dr. Willis said, is we're all in this together. And so taking care of each other has to be intentional. We have to mean to do it. And so I would like us to remember that, when we think about whether or not our decisions to get vaccinated, to seek mental health, and all of that, it has to be something that we do intentionally with the thought process of taking care of not only ourselves, but taking care of our fellow person. Thank you.
Thank you. Jonathan, Dr. Dorth.
Yes, sir. So, again, we started this conversation tonight talking about a long haul COVID survivor and her experiences. Just think about every day how illness can impact you, how death can impact your family. All these diseases that we've talked about today can cause death. And the best way to prevent that is through vaccination. So, really get yourself protected. It is flu season now. Go and get your flu shot. It takes 2 weeks to really build that immunity in your system. So get protected now. Don't wait until it could impact you or your family in the wrong ways.
Thank you. Brother Hershaw.
Thank you, guests, for coming out tonight. Thank you, brothers, for allowing me to share this panel with you. I've enjoyed the conversation, learned a lot myself, and I would just like to tell people that the best way to take care of yourself is self-care, and one of the best ways for self-care is to still wear a mask. When it is approaching, please mask up, even if you do or don't decide to get a vaccine. Thanks.
Thank you. So we would like to, again, thank you for the panelists. Thank you for everyone that attended this evening. Thank you for Miss Maribel Blanco. But more importantly, we would also like to thank this administration for allowing us the platform and the collaborative effort with Good Health Wins to provide this information. If you would please, in the chat, if there are other concerns or health-related disparities that you would like to see additional webinars or programs on, please list those in the chat as we will, on this committee, begin to address some of those concerns as well. Until then, good evening. I appreciate you, and thank you for our behind the scenes, Brother Gibbs Hightower, for your direction and work. Thank you, gentlemen. Enjoy the rest of your evening.